Tuberculosis continues to be a significant public health threat in the United States. Catawba County Public Health provides treatment for numerous latent TB infections and active TB disease cases every year. TB elimination depends on finding and treating TB disease and latent TB infection. This video aims to assist healthcare providers in the detection, testing, and treatment of individuals who are at risk. Targeted testing is used to identify people at risk for TB. Tests used to detect TB infection include interferon gamma release assays and the TB skin test. The pros and cons of each test should be considered using an individualized, patient-centered approach. These tests do not differentiate between latent TB infection and TB disease. If there is clinical suspicion for TB disease, a comprehensive evaluation is needed. Certain people should be tested for TB infection because they are at higher risk for infection, such as close contacts to someone with infectious TB, people from a country where TB is common, people who work in high-risk settings, and infants or children who are exposed to adults at an increased risk. People at high risk for developing TB disease if infected include people with HIV infection, people who have spent time around someone with TB in the past 2 years, babies and young children, people who use drugs, people with weakened immune systems, and those who were not treated completely for TB in the past. IGRA tests are preferred in patients who have received BCG vaccine or cancer therapy, or those who are unlikely to return for a TB skin test reading. TB blood tests require a single visit to conduct the test, but tests may be expensive, and errors in collecting or processing the test may affect result accuracy. TB skin test advantages, disadvantages. This test remains a cost-effective option for screening in most people. The TB skin test is the recommended test method for children younger than 5 years of age. The test is contraindicated in people who have had a previous severe reaction. The TST will need to be read in 48 to 72 hours after placement. If the test is not read during this time frame, it will need to be repeated. False negative tests may result due to anergy, recent TB infection, very young age, recent live virus vaccination, incorrect method of administering the TST, or incorrectly measuring the TST reaction. The TB skin test is performed by injecting 0.1 milliliters of tuberculin purified protein derivative intradermally into the inner surface of the forearm. The injection is made with a tuberculin syringe with the needle bevel facing upward and should produce a wheal of 6 to 10 millimeters in diameter.